Some of the challenges that primary care clinics are facing in taking care of persons living with dementia and their families have to do a lot with the amount of time and the limited time that they have to actually see those patients and families.
One of those challenges is coming to a diagnosis and being able to have a meaningful discussion about a diagnosis of cognitive impairment or dementia. Managing the patient's family and the caregivers that are caring for that individual is also something that's time-consuming, but ultimately really necessary to provide the level of care a person needs when they are diagnosed with Alzheimer's disease or dementia.
What's the biggest problem is that the workforce isn't there. Those of us in primary care, and I don't care if you've got an MD degree, a PhD, a nursing degree of any sort, CNA, it's the same problems. There aren't enough of us.
Project ECHO, which stands for the Extension for Community Healthcare Outcomes, is a guided practice model of medical education to bring enhanced specialty care to local communities. In this way, an expert panel can help inform community providers on best practices in dementia care and reduce health disparities by bringing equitable access to care in all communities.
This is a telementoring program, but it's a two-way street where all of the individual sites are providing just as much information as what comes from the central core team. One of the other unique aspects is that individuals can participate from anywhere around the globe. They don't have to leave their homes or leave their practices or their family members in order to be a part of an ECHO team. I think the most unique thing about the ECHO model is the education that every one of the participants provides. There are individuals serving in underserved communities, people in urban and rural communities, and when a question is brought up by someone practicing from half a country away, we find that the most valuable answer may come from someone who is serving in another community and who has already encountered a similar issue.
The ECHO program offers the opportunity to be in local communities, to support and empower primary care clinicians and professional care providers across the disease continuum, from detection and diagnosis to care management through transitions and end-of-life care.
Person-centered care is so important to the care of the Alzheimer's patient. It's so important as a foundation for the Alzheimer's Association that we actually have one session out of the 12 that's devoted to nothing but person-centered care.
Person-centered care allows for the person living with dementia to focus on their abilities, strengths, and preferences.
If you believe the mantra to be run toward the diagnosis rather than away from it, then you've got every opportunity to make a diagnosis sooner rather than later. The benefits of making a diagnosis early and sooner are that you've got that individual when they're still able to participate more in their care and decide where they want their trajectory for care to continue to go.
We know that there are disparities in the way dementia care is delivered today. And if we can level the playing field through models like Project ECHO, where healthcare professionals and professional care providers will have access to new information and new knowledge as it comes out, then we know that residents and patients within these communities will receive even better quality of care.